Dr. Drew McPhail is here with information on chronic knee pain and a new technology, the MLS cold laser. Doctor, thanks for joining us again. A lot of people suffer from chronic pain, chronic knee pain, for a number of reasons. Maybe they did too much exercise, maybe there's too much weight involved on the knees. There's just a lot of reasons why we have chronic knee pain.
There really are, and it's very debilitating for these patients. It really limits their ability to walk and stand and be active. And a lot of times patients could be from a weight problem, and then now they have the pain, so now they can't exercise. And what we're finding is by being able to rehabilitate these soft tissues and get the knees functioning again, these patients are able to become active, and it helps them basically get their lives back.
And it's not the point of giving the patient a pill to relieve this or that. You've got to go to where the pain is being conducted and look at that. And that's with the MLS cold laser. You're probably, my understanding, the only doctor in the state of South Carolina that has it.
Only one in the Low Country. There's one up in Greenville.
Okay, which is way too far to go. So
Yeah,
they need to come and
kind of
see
far
you.
to travel.
We'll talk about your location in just a moment. Tell us what the cold laser does, because you actually perform this on my knee, which I've had some knee issues, and what I should have done is come to your office for the next 2 weeks and had more treatments because it felt wonderful that afternoon.
Just after that one treatment. Yeah, basically what the MLS cold laser does is it helps to stimulate the cellular respiration, helps get the inflammation down really quickly, and it actually gives the cartilage cells, the chondrocytes, it gives them the energy that they need so that they can start to regenerate. Now, as we age, we lose energy, right? Well, we do it at a cellular level as well, and that's what will happen is these cells just won't repair themselves after they've been worn down. And basically what this is able to do is give the mitochondria, which is the power plant of the cell, give it what it needs so that it can reproduce.
Does it vary with treatments for each patient? I probably need 8 or 10 treatments on my knee for it to really start to heal completely. Could some people only use a couple of different treatments?
Yeah, it depends on the presentation of the patient, just how much degeneration is there, because I mean, we treat patients which you can see, I mean, it's bone on bone.
That hurts.
Like that,
and it really
it's
hurts.
very painful for the patients, but we're getting phenomenal results with those patients. And then we do have patients with just some meniscal tears and just mild and moderate degeneration in the knee.
When you've got that bone on bone that's going on, what does the cold laser do to that joint and around the knee joint itself?
Well, it decreases the inflammation.
Okay.
When you have bone on bone, there's going to be a lot of inflammation
That's a huge positive right there.
Right, so that's going to get the inflammation down, which is going to help. It also helps to calm down the pain fibers. You have nerve cells that send messages to the brain about the pain, and these things are firing off because of the inflammatory response. So by decreasing that inflammation and calming down those pain fibers, we're getting the patient symptomatic relief really quickly. Like within the first couple of treatments, they're going to notice some changes in their symptoms, but then it takes a little bit more time to help rehabilitate those soft tissues. Now, what it also does, it helps to bring fluid, basically it helps capillary function, it helps get the nutrients that they need in there, and helps get synovial fluid, which is a fluid that allows your knee to be able to function.
Which that area may have been starved from those particular fluids that needed to heal over a period of time, and the patient has just prolonged not only the pain, but prolonged the treatment when they need to come and see you and let you do a thorough diagnosis of what's going on.
Yeah, it's as with any other degenerative conditions, the sooner you're able to address it, the faster the outcome. When a lot of these patients start off with just maybe a little meniscal tear, not that big of a deal at the time, but then over time, over a few years, then it becomes more chronic.
You go about feeling the area and then x-ray as well. Normally, how do you determine what area needs to be treated?
We do orthopedic evaluation. We have specific orthopedic tests to test the joint to see which soft tissues are damaged, as well as we do take x-rays, weight-bearing x-rays.
Yeah.
Just because majority of the time when patients are in pain, it's going to be when they're weight-bearing. Some patients experience it when they're in bed, asleep and whatnot, but a majority of the time it's always when they're weight-bearing. So we take weight-bearing films to see exactly what's going on when they're at their...
And a lot of times with that weight-bearing, sometimes when they do lay down or they're sitting, the pain, the relief is gone, but they know as soon as they stand up, it's going to be there because it's got the bone on bone. About how long does the treatment take?
Treatment time we have several different things that we use with the patients during it, but general treatment is about 30 minutes.
And like I say, I've had that treatment done. it's very comfortable. You really don't feel much at all, except for at the end, you feel that there's some relief going on, and that's why I need to come back and continue. I wish you'd have brought the machine in today and get another treatment.
Fortunately, I have patients on it right now, so I'm not able to bring it into the studio.
You got a seminar coming up.
I do. This afternoon at 3 o'clock. We're going to be talking about the causes of knee pain, what the common treatment protocols are up to this point, and how we can effectively manage it.
Okay, and it's all free of charge. Also, your location up in Somerville.
Yeah, we're at 1709 Old Trolley Road, and that's on the Dorchester Road side. And my phone number is 873-2225. So if you'd like to give us a call, we can get you scheduled to come in.
Give Dr. McPhail a call. He'd love to see you, and I'll tell you what, you'll love going and seeing him, that's for sure. I've got more Low Country Live coming up in